Hi, and welcome to Disability Community and Healthcare. In today's video, we're diving into restrictive practices, specifically what they are, the types commonly used, and the legal guidelines that support safe, ethical use. Understanding restrictive practices is crucial for anyone involved in disability support. So let's break it down. Restrictive practices refer to actions taken to manage challenging behaviors, particularly in individuals with disabilities or high behavioral needs. They're generally used as a last resort when there's a risk of harm to the person or others around them. Restrictive practices vary depending on the individual's needs and the type of behavior being managed. Each type of restrictive practice is intended to address specific situations and has strict guidelines to ensure its use safely and appropriately. Let's go through the main types. The first type is physical restraint, which involves using physical contact to limit a person's movements. For example, if someone is attempting to harm themselves or another person, a caregiver might need to gently hold their arms to prevent injury. Physical restraint is always used as a last resort and only for a short period to manage immediate risks. Next is chemical restraint. This involves administering medication to calm a person who is exhibiting high levels of agitation or aggression. Chemical restraint should only be used under medical supervision and typically requires a prescription from a qualified professional like a psychiatrist or doctor. The goal is to reduce the person's distress and prevent harm, not to sedate them unnecessarily. It's also carefully monitored to avoid overuse. Mechanical restraint involves using a device or equipment to restrict movement, such as a harness or safety belt. This is often used in cases where a person may be at significant risk of injuring themselves. For example, a safety belt might be used in a wheelchair to keep someone secure if they have difficulty controlling their movements. Mechanical restraints are used very cautiously and only with strict oversight to ensure they're both safe and necessary. Then we have environmental restraint. This type of restriction limits a person's access to certain areas, usually to prevent them from entering unsafe spaces or from leaving a secure environment. An example might be locking a door to prevent someone from wandering into a busy street or from accessing areas with potentially dangerous items. Environmental restraints should be used minimally and only when there are no other options for ensuring safety. Lastly, there's seclusion. Seclusion involves temporarily placing a person in a quiet, secure space, separate from others, especially if they are experiencing extreme distress or aggression. The goal is to give them a safe, calm area to regain control. Seclusion is only used when there's an immediate need to manage behavior safely, and it's carefully monitored to ensure the individual participants isn't isolated for any longer than necessary. Because restrictive practices limit a person's freedom and autonomy, there are strict legal and ethical guidelines in place to protect the rights and well-being of individuals. These guidelines help ensure that restrictive practices are used only when absolutely necessary and in the safest, most respectful way possible. Let's go through some of these key principles. First, informed consent is essential. Before any restrictive practice is implemented, consent should ideally be obtained from the person involved. However, if they are unable to provide consent, it's necessary to get authorization from a legal guardian or designated decision maker. This ensures that the practice is in line with the person's rights and preferences as much as possible. Secondly, every situation that might require restrictive practices should begin with a professional assessment. This assessment is conducted by a qualified specialist, such as a behavioral therapist or psychologist, who evaluates the individual's specific needs and circumstances. During the assessment, the least restrictive option should always be considered first, reserving more restrictive measures as a final option. Next, every instance of restrictive practice needs thorough documentation and regular review. This means that every time a restrictive measure is used, it should be recorded in detail, including the reason for use, the duration, and any relevant observations. Regular reviews, ideally conducted by a team that includes the person's support network and professionals, ensure that the use of restrictive practices is still necessary and appropriate. These reviews also help determine when the practices can be reduced or stopped altogether. Finally, proper training and supervision for staff are essential. Support workers and caregivers must undergo regular training on restrictive practices, focusing on safety, empathy, and respect. This training helps staff understand not only how to implement restrictive practices correctly, but also how to recognize situations where alternative approaches might be more effective. Supervision from experienced professionals ensures that these practices are carried out safely and ethically. Restrictive practices are sometimes necessary to ensure safety, but the goal is always to use the least restrictive methods and to empower individuals whenever possible. By following these legal and ethical standards, we can create a safer, more supportive environment in disability care. Thanks for watching. If you found this helpful, please like, share, and subscribe for more content on disability support and health care. Your feedback is invaluable as we continue to create content that makes a difference in the lives of individuals with disabilities.